Welcome to the deep dive. If you or maybe someone you know has been dealing with that kind of chronic, just unexplained pain, maybe in the back, neck, or shoulder, the kind that, well, physical therapy and maybe anti-inflammatories just don't seem to touch,
Right.
then this deep dive is definitely for you. Our mission today is really to crack a frustrating diagnostic code. We're looking into sources that show a direct, sort of mechanical link between this persistent musculoskeletal pain
Yeah.
and a deeper, often ignored issue, liver dysfunction.
And that distinction, that idea of dysfunction versus actual disease,
Mm.
is really key here. It's foundational to what we're exploring.
Okay.
When we talk about the liver, most people, and honestly, even a lot of professionals, they look for clear disease.
Yeah.
Something obviously wrong, something that shows up glaringly on standard tests.
Like blood work or scans?
Exactly. But what keeps people stuck in this chronic pain loop very often is dysfunction. That's when the organ is just struggling. It's overloaded. Maybe it's not detoxifying effectively.
Even if the tests look okay.
Even if your blood panel results might still fall within that, technical normal range, this subtle dysfunction, it's like a ghost in the machine. It's notoriously hard to pin down.
That sounds like the definition of a diagnostic dead end. But the sources we looked at, they provide an almost, well, an unsettlingly clear symptom map for where this internal struggle shows up externally. If you've got chronic pain, you should listen closely to where the liver might be referring trouble.
It really does create a specific signature. We're talking about pain that's overwhelmingly concentrated on the right side of the dorsal spine.
Okay, the mid-back.
Yeah, mid-back. And it's not just general stiffness. This is often a localized cluster of discomfort. People describe it as a tight, sometimes burning spot right between the right shoulder blade, the scapula, and the spine itself.
Mm-hmm.
Specifically, the sources point to issues around the T5, T6, and T7 vertebrae.
Right, where you can never quite reach to scratch it. But it doesn't just stay there, does it? The symptoms can spread.
Oh, absolutely. The pain can radiate along that right costal arch, the ribs. Sometimes it wraps around and feels almost like chest discomfort.
Which must be worrying. People might think it's their heart.
Exactly. It can lead people to fear cardiac issues. And then the tension often works its way up. It causes referred pain into the neck, the cervical column, and even the base of the skull, the occipital region. This can lead to persistent, really baffling headaches.
And you mentioned the shoulder, too. This seems to be a big one.
Yes, and this is maybe the most confusing and common symptom, the one that often sends people straight to an orthopedist: persistent pain in the right shoulder. It frequently gets diagnosed as some form of chronic periarthritis.
So inflammation around the joint.
Precisely. And if you, the listener, have relentlessly treated that joint, maybe with injections or rehab, and the pain just keeps cycling back, well, this deep dive strongly suggests the cause might not be in the joint itself. It might be visceral. It might be the liver.
Okay, let's really unpack this diagnostic trap then. If the liver is potentially the main culprit, why does the typical patient journey focus almost exclusively on treating the symptom, like the shoulder or the back pain?
Well, it really comes down to a kind of diagnostic hierarchy, you could say, because it's so challenging to measure and pinpoint subtle liver dysfunction.
The kind that doesn't show up on standard tests.
Right. Professionals often default to treating what they can see and measure, the physical manifestation of pain in the joints or the spine. But here's the really shocking realization that comes out of the source material. The common remedy often becomes part of the problem itself.
Wait, are you talking about the anti-inflammatories? The painkiller?
Exactly those.
Yeah.
Prescribing anti-inflammatories and analgesics to manage that symptomatic pain, well, our sources describe it as a double-edged sword.
Okay, we need to expand on that because that feels like a huge point. Are we actually saying the very treatment prescribed for relief could be, well, toxic to the underlying issue?
That's precisely the implication. These medications aren't just masking the pain signals.
Yeah.
They have to be processed, right? They need to be metabolized and filtered
By the liver?
by a very organ, the liver, that was potentially already struggling to begin with. So you're essentially just loading more burden onto an already failing filter.
Wow.
And the result, according to these sources, can be pretty catastrophic over time. The pain tends to become more chronic. The medications, they become less and less effective as the liver's capacity diminishes.
Then the liver itself.
The dysfunctional organ actually starts generating more inflammatory referred pain. It just accelerates this whole vicious cycle.
That paints a really bleak picture of a systemic breakdown that sounds incredibly hard to escape. But this isn't just about phantom pain signals, is it? The sources suggest this liver dysfunction causes actual measurable structural damage. It changes the body's mechanics.
Yes, it absolutely moves beyond just nerve signal sending pain somewhere else. The sources explain that when the liver struggles to process and filter toxins effectively, these toxins don't just, float around harmlessly.
Right.
They can literally accumulate. They are built up as highly concentrated toxic materials. The sources use the metaphor of crystals in specific sensitive areas of the body.
Where exactly?
They seem to fixate, particularly in the articular capsule and the synovial membrane of joints.
Right, so the lining and the sac around the joint.
Exactly. The synovial membrane produces the joint's lubricating fluid, and the capsule encloses it all. If these areas start accumulating this toxic buildup, these crystals, the joint itself becomes genuinely inflamed. It can feel gritty, physically compromised.
Okay.
This seems to be the root cause of that chronic, persistent right shoulder periarthritis we talked about.
So the shoulder pain isn't just random inflammation or wear and tear. It could be the physical fallout from an internal toxic cleanup failure.
And that internal toxicity seems to trigger another physical change, one that really locks the shoulder into dysfunction. Hepatic dysfunction liver trouble can cause the right pectoral muscle, that big chest muscle, to seize up, to retract or spasm chronically.
Okay, I can picture that.
And this muscular retraction physically pulls the entire shoulder girdle forward. It's a posture known as antipulsion.
That makes total sense. If your main chest muscle is constantly tight and pulling forward, it completely throws off your shoulder alignment.
It compromises the entire biomechanics of the joint. It messes with how the rotator cuff muscles can function, forcing the joint to operate outside its normal healthy groove. So, you can stretch and strengthen that shoulder all day long.
But if the underlying trigger remains.
Exactly. If the liver continues to trigger that pectoral retraction, you're basically fighting a losing battle against a joint that's perpetually being destabilized from the inside. And if we follow that physical chain reaction up the spine, we see an even more maybe devastating pattern emerge. That continuous referred pain signal from the liver, plus the mechanical effects, leads to a blockage. A lack of normal mobility in that central dorsal column, specifically that T5, T7 segment we pinpointed earlier.
Right, the mid-back gets stuck.
Yeah.
And the spine, like any structure, has to compensate if one part isn't moving, right?
Precisely. A lack of movement, a blockage, in the dorsal spine forces the segment directly above it, the cervical column, your neck, to pick up all the slack. It has to do all the compensatory movement.
So the neck starts moving too much.
Way too much. The neck is forced into hypermobility. It moves far more than it's designed to, trying to make up for the lack of motion further down.
So instead of having a stable base in a mobile mid-back, the neck is kind of, well, shaking loose because it's being overworked.
That's a good way to put it. And that excessive forced movement accelerates the physical breakdown of the cervical region itself. The sources clearly indicate this hypermobility significantly speeds up the wearing down of the intervertebral discs in the neck.
Well,
An unstable column just creates wear and tear much faster. And this dramatically increases the risk of disc bulging or even outright cervical disc herniation.
that is a staggering connection. So you might be going to the doctor for a painful cervical hernia, maybe with nerve pain shooting down your right arm, thinking you lifted something wrong. But the root cause might not be that incident at all. It could be a compensation pattern, starting with a locked up mid-back driven by your liver.
It completely flips the script on where you need to look first.
Okay, so we've established this is a really systemic, multi-layered problem. When we look at the root causes, obviously, poor diet, chronic nutritional stress on the liver, those are the sort of visible culprits, right? Most people get the link between a bad diet and organ health.
Sure, that's really well understood.
But our sources point really strongly to an equally potent, maybe even more insidious driver because it's less tangible.
Yes, and what's fascinating here is the absolute clarity in the sources about this often missed cause, psycho-emotional stress.
Okay, define that a bit more.
We're talking about things like chronic anxiety, maybe repressed anger, high levels of stress that you just carry around day in, day out.
I think a lot of listeners can relate to feeling stress physically, like tension in their shoulders or a knot in their stomach, but we usually just dismiss that as muscle tension. Are these sources really suggesting that this purely emotional state can physically destabilize the liver itself?
They're very direct about it, actually.
Yeah.
Stress makes the liver function unstable, erratic. And because this cause is intangible, right? It's not a virus. It's not a measurable toxin you ingested. It's not a vicable lesion.
It makes it hard to diagnose.
Exactly. It makes both the initial diagnosis and then the subsequent treatment profoundly difficult. It really reinforces the fact that the nervous system, our emotional state, and our visceral organs are not separate things. They're a single, deeply interconnected unit.
So if you're struggling with a persistent physical problem like this,
You absolutely have to acknowledge the potential psycho-emotional component that might be driving or at least contributing to it.
okay, this brings us to, arguably, the most crucial part of this deep dive, the solution. If the problem is truly visceral and systemic, originating deep inside, the sources explain very clearly why traditional joint treatment like physical therapy or injections focused only on the painful shoulder or neck is basically doomed to fail in the long run.
Right, because you're working on the downstream effect, not the upstream cause. It's like mopping the floor while the sink is still overflowing.
Makes sense.
If you only address the articular pain, the joint pain, the underlying liver dysfunction probably remains. That pectoral muscle likely stays retracted. The dorsal spine tends to stay blocked. And the pain will inevitably return, often quite quickly, maybe within days or weeks of treatment ending.
So what does this highly specialized therapeutic approach actually look like? What's the required order of operations according to these sources?
Order is critical. You absolutely must respect the sequence. Visceral work first. The number one priority is to liberate and decongest the liver and all its supporting structures. This involves highly specialized manual therapies. We're not talking about deep tissue massage on your back here.
Right. What does it involve?
It's focused not on the bones or muscles initially, but on the visceral organs themselves, working specifically on the fasciae, that connective tissue web that surrounds and supports the organ. The supporting ligaments that hold it in place, the visceral organs themselves, feeling for restrictions, and crucially, the diaphragm, which is intimately connected to liver movement.
Okay, just to clarify for the listener, what does working on the fascia or the organ actually feel like? Is it painful?
It's generally quite gentle, actually. It involves precise, often subtle mobilizations. The aim is to release the physical tension that's basically inhibiting the liver's ability to move naturally and function properly within the body cavity.
Move. The liver moves.
Oh, yes. A healthy liver moves slightly with every single breath you take. When it's dysfunctional or stressed, it often becomes rigid, sort of fixed in place. The goal of this visceral work is to restore that normal physiological mobility and release those deep tensions. That, in turn, takes the pressure off the nerves and surrounding structures that are causing that referred pain signal.
I understand the theory. But let's say someone listening has this chronic pain and maybe their doctor is telling them they need immediate orthopedic intervention, perhaps for that suspected herniated disc in the neck. What do the sources say about the risk? Why focus on the leaguer first?
That's a really important question. The sources emphasize that delaying the joint-specific treatment is often necessary if that joint pain is primarily the result of the upstream blockage. Think about it. If you aggressively manipulate an unstable, hypermobile cervical spine before you've released the underlying dorsal blockage caused by the liver,
You could make it worse.
you risk aggravating that very hypermobility, potentially destabilizing it further. By addressing the root problem, first, stabilizing that dysfunctional dorsal segment, by treating the liver, you create stability for the entire spinal column.
Okay, so once the visceral harmony is starting to be restored, the liver is less irritated, less restricted, then you can move on to the physical structure.
Exactly. Then you do the articular work, and you logically begin where the problem first translates physically the dorsal column, especially that T5, T7 area. The goal is to restore proper movement right where the blockage originated.
And how is that done?
This typically involves skilled manual therapies, often combining techniques from osteopathy, chiropractic, and other vertebral manipulation approaches. The aim is to restore joint harmony along the entire spinal chain, working up into the neck as needed, once the foundation is stable.
Now, what about the actual physical damage that might have already happened, like those worn-out discs you mentioned, or that chronic shoulder periarthritis? Our sources mentioned some specific complementary treatments used to tackle those established physical problems, right?
Yes, they did. For disc issues, actual herniations or significant protrusions, one of the techniques mentioned is ozonotherapy.
Ozone, like the gas.
Exactly. It involves carefully injecting medical-grade ozone gas, which is a highly reactive form of oxygen, directly into the paraspinal muscles near the affected disc. The theory is that the ozone creates a localized oxidative reaction that can help dehydrate or slightly shrink the bulging hernia material.
To reduce its volume.
Precisely. To reduce its volume just enough to stop it from compressing the nearby nerve root.
What's the advantage of using ozone gas compared to, say, traditional steroid injections or other things they inject?
Well, the key takeaway for the sources on this specific technique is that it's presented as having practically no contraindications. Because you're not using a pharmacological medication, there's less systemic burden. It's viewed as a targeted, minimally invasive way to potentially address the physical disc issue without adding more chemical stress to the body's metabolic system, which, as we've discussed, might already be overloaded.
Okay. And then addressing the structural fallout, like that pectoral muscle tightness, pulling the shoulder forward, the antepulsion. How do you physically realign a body that's been pulled out of balance by an organ?
Yeah, that requires dedicated work. It needs specialized postural therapy or postural re-education methods. The sources mention systems like global postural re-education or GPR as examples.
What do those involve?
These methods are essential for reharmonizing the entire muscular chain system. The therapy focuses specifically on gently stretching and rebalancing those tight anterior chains, like that chronically retracted pectoral muscle,
Wow.
while simultaneously re-educating and strengthening the posterior chains.
The back muscles.
Right, to properly support the spine and hold the shoulder blade in a correct, non-compensated position. You're essentially retraining the body's entire posture, muscle by muscle, to undo the compensations forced upon it by the liver's influence.
And finally, because we acknowledge that huge role of psycho-emotional stress, the sources mention psychometabolic support. This isn't just about, relax more, is it?
No, not at all. It's presented as a combination of physical and emotional support working synergistically. On the one hand, it involves actual psychological containment, maybe therapy or stress management techniques, to help the person manage and discharge the chronic stress that might have destabilized the liver in the first place.
Okay. And the metabolic part.
Furthermore, the sources mention the clinical use of ozonized serums. These are typically administered intravenously, systemically.
More ozone.
Yes, but used differently here. The idea is to help deharmonize or rebalance the overall metabolic system. This systemic support is thought to help combat the fixation of those inflammatory toxins, those crystals, in the joints and tissues, thereby aiding the resolution of the chronic inflammation that resulted from the toxic overload.
So the final synthesis here, the big picture, seems to be one of profound specificity. This chronic, almost rheumatic-like pain that drives people crazy, getting test after test, only to be told everything looks fine. The complexity isn't necessarily in the problem itself, but maybe in our failure to look in the right place, in the right order.
Exactly. It's about recognizing that the pain in your shoulder or your mid-back might just be a very loud signpost for a deeper, perhaps quieter failure happening elsewhere in the system. And the therapeutic approach absolutely must start upstream. Focus visceral work first to liberate the organ and calm the system, followed by targeted articular work to fix the structural consequences. That order seems to be everything.
So what does this all mean for you, the listener, the learner? Hopefully this knowledge provides a new, maybe powerful lens. If you've experienced that kind of persistent pain that just resists conventional joint or spinal treatments, you now have some insight, some framework to recognize when superficial relief might just be masking a deeper systemic metabolic issue, potentially driven by an organ you never even suspected.
Yeah, and this deep dive really suggests that sometimes the most effective path, maybe the only path to lasting physical relief, requires us to treat what's happening inside first. Our metabolism, yes, but also our often ignored emotional stress load, before we even touch the place where the pain is shouting the loudest.
It's a completely different way of thinking.
It is. And this whole cascade kind of forces us to ask, doesn't it? What other common aches and pains, the ones we maybe casually dismiss, might actually be signposts? Little signals pointing toward an organ dysfunction or a systemic imbalance we haven't considered. It's worth reflecting on that concept of referred pain because your body might be trying to tell you something far more important than just, my shoulder hurts today.